Early in the pandemic, many health insurance companies across the country waived fees associated with any COVID treatment, but those copays and deductibles are making a comeback. Channel 8's Alexa Skaneski has all the details in our coronavirus news tonight. Alexa?
Yeah, that's right. Now that we have more knowledge on COVID-19 and readily available vaccines, insurance companies are saying it's time to start paying those bills again. Nebraska health insurance companies stepped up when the pandemic started. If you had to be tested or treated for COVID-19, your insurance covered those costs. And they even took a step further, covering deductibles and copays, resulting in zero out-of-pocket expenses for any COVID treatment in 2020. But times have changed. Many insurance companies are no longer waiving those fees and now treating COVID like they would any other illness because they say we have enough knowledge and treatment now for the coronavirus.
If you go to the doctor's office and you have a copay, you'll pay the copay. If you have to be hospitalized or get additional testing, then it's going to be subject to the normal rules of your health insurance policy. So you may have to cover the deductible and things like that.
When COVID testing sites first opened last year, testing was almost always free, but that's no longer the case. Several places are now asking for an insurance card. And if you walk into your doctor's office or an urgent care and want to be tested, whether or not that testing is going to be paid for by your insurance will depend on the guidelines of your policy. If you have symptoms or significant exposure, then typically yes, insurance would cover. But if you're getting tested just because, chances are that will not be covered. All of this comes as a new rule was issued by President Biden. Businesses with over 100 employees will need to either get the vaccine or submit to regular testing. For those who would test weekly, that could potentially come at a very high cost depending on who's paying.
If you Google that, you'll get a lot of different pieces of information. And some of it says, depending upon the employer, it may be covered by the employer. Sometimes it could be at the employee's expense.
Across the country, people are seeing their COVID medical bills for the first time and taking on the financial responsibility. And that's causing some harsh realities for those who not only survived COVID, but potentially lost their income during the pandemic. McPike says there are resources available to help those who need financial assistance for medical bills. She says call whoever sent you the bill and let them know you need help.
Please address it. Please talk to them and let them know what your situation is, as opposed to the other option of I'm going to ignore it. If I ignore it, it's going to go away. You're not the first person who's run into this situation. And it's not anybody's intent to cause your financial ruin. Let's work out a solution.
By the way, these insurance companies have been operating under federal emergency measures, which is set to end on October 17th. Time will only tell if that will be extended or not.
Some great information there affecting really everyone, Alexa. Thank you very much for that story tonight.